Samuel Ivaha Diboa makes his first official outing after recovering from the coronavirus. The governor of the Littoral region, accompanied by other administrative officials, has inspected specialized centers in the economic capital hosting COVID-19 patients. We shall be having more in this newscast. Also, the Ministry of Public Health is also examining alternative solutions as scientists look for a remedy against the coronavirus. Discussions with Archbishopsamuelkleda's traditional solution as well as the COVID organic from Madagascar will be underway in the days ahead. Those are top stories. Good evening, ladies and gentlemen. Thanks for joining us. You're watching the primetime newscast on STV. The governor of the Littoral region, accompanied by other administrative officials, have made a visit to some specialized centers to host patients suffering from COVID-19. It is the first outing of Samuel Ivaha Diboa after his miraculous recovery from COVID-19. Katrin Kone trailed the delegation and now reports.
In line with measures put in place by the government to contain the coronavirus pandemic in the country, the Littoral Governor Samuel Ivaha Diboa today has inspected the construction progress on some sites in Douala where positive cases will be quarantined. The governor was accompanied by some authorities and made a first stop at the Yassa site.
I'm here to see how the site reserved for the confined people is going on. They are working very well, and the place is good for about 400 people. And I'm asking all those who are going to come here to be disciplined, because you cannot run away. Running with a virus, it is just going in front of your death. It's better to stay and to see how people can come, the doctors can cure you before going, you see.
While on the field, the governor urged the population to shun fear and trust the government's move in eradicating the deadly coronavirus.
I'm asking the population of Douala to be confident. The head of state is doing many things, but is not making noise. And the government also is working towards the measures that the head of state are taken. So I'm asking people to be disciplined. To wear those masks is not a question of, let me say, to show that I am well dressed. No, it is just to protect each other. Because when you are talking without mask, you don't know you are transmitting the disease. Tomorrow the other one is going to ask, what have I done? You see. So I'm one of the one who was at that level. There is no discrimination to do for the people that are sick or not. Today I'm well. I've made my test, I'm well. Yesterday I was a dead man, and you see. But you have to encourage everybody to see that solidarity is a good thing. If you understand that your brother is ill, don't run. No, stay and say how you can help him to be cured.
From the Yassa side, the governor and his convoy moved to the Lakintani Hospital, Mbapelepe Stadium, to conduct the same exercise. It should be noted that this is the first outing of the governor after he recovered from the pandemic.
The presidential aid worth 2 billion francs CFA has finally been dispatched to the regions in a ceremony chaired by the Minister of Territorial Administration in Yaoundé. Governors will ensure that the health kits destined for the 360 council areas are distributed fairly. The committees will comprise the divisional officer, the mayor, the forces of law and order, as well as traditional rulers. At the end of the exercise, they will have 10 days to submit a report on the operation. In the meantime, the Prime Minister, head of government, has assured stakeholders in the transport and hospitality sector that government will look into their worries. This was during a meeting in Yaoundé with trade union leaders of the sectors. Now, as scientists look for a remedy against the COVID-19 pandemic, the Ministry of Public Health is also looking for alternative solutions in order to beat the pandemic, while a team from the ministry will meet the Archbishop of Douala to get more information on his traditional medicine. Experts from Madagascar are expected in Cameroon to explain more about COVID organic, which is the cure designed by the Malagasy people for COVID-19. More in this report.
It became news on social media in Cameroon on April 25, 2020 that His Lordship Samuelkleda, the Archbishop of the Douala Archdiocese, has found a cure for COVID-19 pandemic. Responding to the rumor, the Archbishop confirmed to media organs on Saturday that he came up with a possible remedy that was administered to some coronavirus patient. He said the patients later recovered from the illness and tested negative. The medicinal invention by His Grace Samuelkleda is made up of natural plants. With his 30 years experience on studying medicinal plants, the bishop had focused on treating ailments affecting the respiratory system. The indicated possible remedy was sent to Catholic hospitals across the metropolitan archdiocese to deal with early symptoms. After the information of His Lordship Samuelkleda's treatment of the deadly coronavirus, Cameroonians became eager if the government of Cameroon will embrace the discovery and validate. In a tweet this morning, some anxious Cameroonians asked the health minister on government's reaction regarding His Grace Samuelkleda's natural remedy for COVID-19. Minister Manahoda Malashi replied that he has sent a team of health experts to Douala to evaluate the solution treatment for coronavirus pandemic. However, out of Cameroon, Madagascar had earlier launched a drink which they reviewed could be a possible remedy for coronavirus patients. The particularity is that Madagascar President André Rajoelina had validated the product and had distributed for free to citizens. Cameroon Health Minister also stated that the country will receive a visitor from Madagascar to know more on the COVID-19 product. Question posed, will Samuelkleda discovering be approved in Cameroon?
8 billion francs CFA is the amount already spent by the government in its COVID-19 response. Experts from the Ministry of Public Health have revealed the information at a time when the collection of funds has gathered steam. Our reporter Violet Senku met an expert who evaluates the financial management of the crisis. Her report.
Over 1,000 confirmed cases in Cameroon who are presently quarantined and taken care of at different health facilities in Yaoundé and Douala. Elise Amo-Eyanga unveiled the level of financial responsibilities the government has, which has been lightened through the Solidarity Fund opened by the head of state, Paul Biya, in response to the pandemic. He further gives details of how these funds have been managed so far.
For the patients, we have all the medic drugs provided by the health facility. We also have all the commodities, something like the room, the feeding, the washing of clothes, and all other aspects concerning the equipment and other tools involved in the response or the cure of the patients.
He again reveals not only victims of COVID-19 get supported from the Solidarity Fund, but as well health personnel.
Concerning the health personnel, they have to be protected, so they have individual protective equipment. Some things like gloves, suits, masks, goggles. That are the thing we used to buy and provide to the health personnel in the health facility.
Elise Eyanga says, so far the government has had about 800 million disbursed by the state, which is a contribution from individuals and enterprises to combat the ravaging COVID-19 in our society.
Plans to reopen schools and ease COVID-19 restrictions by June 1 show the situation of the pandemic improve in the country, but medics have urged the government to construct schools as well as ensure hand-washing points to ensure that the pandemic is kicked out of the school milieu. More in this report.
Following the deconfinement of learning institutions and other structures, which may take place on June 1st, has some drawbacks, according to health expert Jean-Paul Com, who says the government has to work towards school reopening if propagation of this virus wants to be barred. The inavailability of water in some schools should be addressed, and social distancing should also be made a reality.
Imaginez-vous dans une école où on a 1000, 2000 enfants. Il y aura d'abord le premier problème qui est le problème d'eau. Est-ce que ces 2000 enfants, à chaque entrée, doivent-ils laver les mains avant d'entrer?
In a school of about 2,000 children, and each child is supposed to wash their hands before entering into classrooms. In such case, water may not be enough. Moreover, is there enough running water in all schools? Likewise, parents would have to provide hand sanitizers to their children. It is difficult to prevent children from playing and touching one another, but we are obliged to keep observing the preventive measures prescribed, given that we don't know when the pandemic would resurface. The government has to build more classrooms and provide more benches in order to fully respect the 1 meter distancing, which is not possible in our country.
Il faudrait reconstruire ça de classe. Il faudrait d'autres bancs. Et si on veut maintenir 1 mètre à 1 mètre 50 de distanciation, ce qui n'est pas possible chez nous.
He further reveals teachers on their part have to be educated on these symptoms of the virus for easy spotting if one is seen.
Bon, là maintenant, il faudrait que les maîtresses sachent effectivement les 4 signes qui permettent de faire attention aux symptômes de
Now, the responsibility will be on teachers who should stay vigilant to make out the COVID-19 symptoms such as cough, cold, fever, and breathing difficulties. Any of such symptoms should be reported to the administration.
2 ou 3 de ces signes, elle devait déjà voir sa direction.
Conclusively, he says, before school resumption, the government should get stricter on hygienic measures and not slow down, because if propagation of COVID-19 continues, Cameroon may record more victims.
Persons in the nation's capital, Yaoundé, say that they find it difficult to align to government's anti-COVID-19 measures. Shop owners in particular are lamenting that customers are resisting the demand to wash their hands before business transactions, despite the availability of washing points. Details with Vale Senko.
It's been about 2 weeks since the Prime Minister Joseph Ngute added 7 reinforcing preventive measures to contain the spread of the virus. Visiting some shop owners who are doing everything to align themselves to these preventive measures of having washing points and putting on face masks and social distancing, decries their customers are not helping situations.
La mesure est celle que le gouvernement a déjà prise. Déjà à notre niveau, nous avons déjà l'eau pour.
We are simply going by what the government said, and we have some clients who refuse washing hands, so that's why we have a hand sanitizer. And on our part, we have tried to have face masks for all our workers, and we are trying to maintain the social distancing even from our clients.
Nous essayons un peu, dans la mesure du possible, à respecter la mesure de distanciation, de nous mettre un peu à 1 ou 2 mètres de nos clients.
C'est comme nous avons prévu d'abord, nous avons notre savon et notre seau d'eau qui est là à côté de nous.
There we have water and soap where each client has to wash their hands before stepping in. But some clients refuse washing their hands, and not to inconvenience them, we offer them hand sanitizers inside to disinfect their hands before any transactions. These shop owners nevertheless say business is getting from bad to worse each day since the outbreak of COVID-19.
Ça a un très grand impact dans notre activité, dans la mesure où la plupart des produits.
It's a big problem since most of our products come from Nigeria. Now people no longer travel and our products become scarce. Also, most of our clients say things are difficult, so we can't sell either.
Ce qui fait que nos recettes sont vraiment réduites.
l'entreprise, il y a vraiment beaucoup de baisse.
We are just struggling these days. We don't have customers,
Donc,
which
on n'a
make
plus
things
assez de clients
difficult
comme
for
on
us
avait
to.
avant. C'est déjà un peu difficile pour nous.
Par rapport à l'activité, du coup, tout est au ralenti. C'est à peine si nous pouvons faire même des recettes, même de 5 000 par
Well,
jour.
all our
Si nous avons
activities
à
have
peine
been slowed.
10 à 15
Before we could
clients
make
qui
at least
entrent,
5,000
nous
per
pouvons
day.
passer des heures
But
sans
now it's not possible, and I
savoir de
spend my day
clients.
reading and praying too.
Nos journées,
So
nous les
it's just
passons
God who can
moi,
save
j'aime
us
bien
from
la
this
lecture,
crisis
donc je
too.
passe mon temps à beaucoup lire et peut-être à prier aussi. Donc nous croyons qu'il n'y a que le Seigneur Jésus qui peut nous sortir de cet état de crise.
Most people in the Yaoundé neighborhood are slowly but surely adopting to these hygienic measures put in place by the government to bar the spread of the deadly pandemic.
As Muslim faithfuls in the country wrap up the first week of the Ramadan fast, small-scale businesses are sprouting around mosque in total disregard for government's measures against the coronavirus. Ajwa Ali has been observing the phenomenon and now reports.
Spontaneous businesses around the mosque in the economic capital Douala has taken the center stage, with the Muslim community having the habit of breaking fast with variety on their table. These petty traders around the mosque, from all indications, are partially implementing measures to stay safe from the COVID-19 pandemic.
Le cache-nez que j'ai mis sur mes yeux, sur ma bouche pour protéger le coronavirus. Je me protège, je lave ma main avec
I protect myself from coronavirus by putting on my face mask. I wash my hands with disinfectant, and I don't sell to people without face mask.
Je lui dis que non, je ne vends pas à la personne qui ne met pas le cache-nez. La personne qui met le cache-nez, c'est la personne que je lui sers avec mes choses. Parce que
Islamic authorities, from the beginning of the month of Ramadan 2020, have advised that all these petty traders around the mosque should follow government measures to stay safe.
The same way, the market during the period of Ramadan that some young people organized near the mosque should be prohibited. Nobody can make the market in front of the mosque or anywhere in the road because the condition is not available to be very pure. It should be the other factor where the virus of corona should be transported from another to another. That is why we ask of the imams and ulema, the religious teachers and religious believers, to observe this Ramadan, because Ramadan teaches us a love, spiritual life, and also guide the believer to be in the goodness and in the good be.
As the Muslim community moved through the first week of fasting, majority have been called upon to respecting basic rules on hygiene and sanitation as means to combat COVID-19.
The third phase of the COVID-19 response in markets in the Douala 1 Council area has been implemented over the weekend in the Mbopi market. The mayor of Douala 1, Jean-Jacques Lengue Malapa, who supervised the operation, has called on traders as well as customers to respect the measures set aside by government against the pandemic. Ladonet Oni has more.
The large crowds found in markets, coupled with the different activities carried out, makes it a habitable ground for different viruses and bacteria. This has therefore pushed the mayor of Douala 1, Lengue Malapa, into carrying out a disinfection campaign for all the markets in his locality. From the new Daido market, the council has marched down to the Mbopi market with tanks full of disinfectants so as to thoroughly clean the market.
Une lutte acharnée et ardue au Covid-19, et les marchés sont des lieux
We are waging a serious and relentless war against COVID-19, and with markets being a place of circulation and possible contamination, it's fair that on a Sunday when there are few people, we, the council, and some friends can come together to disinfect this market.
Amis nous aident à faire la désinfection de ces marchés.
Face masks and other COVID-19 kits were also distributed while carrying out this exercise.
Nous travaillons dans la distribution des masques aujourd'hui et nous sommes heureux de constater.
We distributed face masks, and I noticed that Cameroonians, especially those in Douala 1, have been more conscious to applying these measures. That is, social distancing, wearing of face mask, and washing of hands.
Distanciation, dans la mesure du possible, le port du masque et bien entendu le lavage des mains.
The traders, through the market president, cheered the actions of the mayor while outlining their own efforts put in place to fight against the COVID-19.
Vraiment, le marché Mbopi a apprécié. Tous les commerçants du marché Mbopi sont contents.
The traders of this market are very grateful and happy for the bucket and everything given to us. Since 2014, we started the cleaning campaign. You can see it every week that we sensitize people, but some are resistant. But we put in all our efforts so as to keep the market clean.
Mais on fait tous les efforts. Grâce au maire, je dois la prévenir. On fait plus d'efforts pour mettre le marché propre comme vous voyez là.
It should be noted that this sensitization campaign started on the 12th of April with the Santagar market, and the Mbopi market is the third market to be disinfected in the Douala 1 municipality.
Out of the country, as American doctors fight one of the world's largest outbreak of COVID-19, several are reflecting on what they wish they knew when the crisis first began, at a time when more than 54,000 people have died in the United States from the virus. We have more with the VOA.
With the U.S. accounting for nearly 1/3 of global coronavirus cases, some doctors in the United States say they've learned a lot on the front lines of the battle against the disease. That includes a better understanding of how to help patients who come in with low oxygen, for example, says the medical director of the Mount Sinai Hospital Emergency Department.
What we saw early on is that as soon as somebody started to get, to 6 liters of oxygen on this nasal cannula, they just got worse and worse, and so we jumped to intubation. Now we're realizing that probably something in between for some patients, like putting them on that high flow oxygen or putting them on that BiPAP, may actually be okay for some. The other thing that we've learned is that actually you can prone people.
Proning is a method of lying patients on their belly that has been successful, explains another internist and critical care cardiologist at Columbia University Medical Center.
The theory is that the lungs are like a sponge, and if you lie on your back for a very long time, that gravity sort of pulls all the secretions and the fluid and mats down that part of the lung, and that by flipping people over, you free up that space in the front of the torso to allow the lungs to open and expand and give better oxygenation, and it works.
She also says hospitals ran short of key equipment, something hospitals in Italy, Spain, and other hotspots have also experienced.
We all wished, for the sake of people, that we had recognized that this was coming earlier, could have had things in place for hospitals to manage patients, probably could have prevented a lot of the mass amounts of people that came in all at once, had more PPE available so that people weren't without it.
Internist Dr. Anju Gawel says the most surprising has been how the virus affects the elderly.
What I did not recognize was the severity of illness that would be seen in patients who are older. Had we known that, we could have instituted more restrictive control measures to prevent exposure to that group, and also to get very early treatment for that group to try to prevent the complications.
For most people, the disease causes mild symptoms such as fever and cough. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia, and can lead to death. Mariama Diallo, VOA News.
And that does it for the primetime newscast on STV. Thank you very much for watching. More news comes up at 8 p.m. in the French language with Renee Narcisse Moto. From the entire team in Douala, have a good night and stay safe.